Hi there, my name is Dr. Carnes, and I am here today to talk to you about a couple of our neurotoxins that we have here at Capentina Day Medical Spa. We carry two brands. One is Botox, which most people recognize as one of the oldest neurotoxins available. The other that we carry is one of the newest, and its name is Daxxify. And we've been using Daxxify now for about a year. They both have really great effects on the face and can really diminish the effects of fine lines and wrinkles. The benefits of Daxxify over Botox are that Daxxify will kick in a little bit sooner, within 3 days as opposed to 7, and it will generally last a little bit longer than Botox, although it's person dependent. A lot of times we get questions about how many units most people need. So I'm going to kind of point out some of our most common areas and let you know about how many units. Okay, this is Maggie, and you can come see her to get your nails done anytime. But Maggie's pretty young, but I will go through the different areas and tell you what we would recommend for her, and then what kind of an average for an older patient would be. So the first area would be the forehead. So Maggie, go ahead and lift your eyebrows up. Okay, so you can see Maggie doesn't have a lot of wrinkles, but a few lines that you can see when she lifts up her forehead. So for Maggie, I would probably go pretty light with 5 to 10 units. But in our average person, I would say we use about 15 for someone who's in their 30s or 40s or higher. So the next is the 11s, and these are the lines between, right here, between the eyebrows that people use when they make a mad face. So go ahead and make a mad face. Okay, and she has pretty strong 11s. Relax. She doesn't have any lines when she's relaxed yet, but over time she may develop some if she's not using any kind of toxin to keep those muscles relaxed. So for Maggie, I'd probably use 10 units, but in the average person, it's probably closer to 15 to 20, depending on the strength of those muscles and the deepness of their lines. The next area would be the crow's feet. So Maggie, could you turn and look at the window and go ahead and smile real big for me? Okay, Maggie does not have a lot of crow's feet at all. Go ahead and look straight at the camera. I'm not sure. If I did treat Maggie, I would probably only do a unit in each area, which would be 3 units per side. But for patients in their 30s, 40s, or higher, generally we're doing about, I would say, an average of 9 units, but it ranges between 6 and 12 usually. And then the last area, I'd like to point out that we get a lot of clients coming in and wanting a lip flip. And so a lip flip is where you get a subtle definition of the lip, and we inject 4 units into the area of the lip. That's 4 units total, and it just gives a slight subtle lift for the clients that want a little bit of a bigger pout, but not enough to want filler injection.